everyone, good evening. Hello everyone, how are you all doing? So, we're going to have a different topic for today. I think will be more exciting. And we have Dr. Charan who will be joining us. Let us all welcome him. Hello everyone. Hello Rishita. Hello. Nice to see you all. Good afternoon. Hi Dr. Charan. Good
Hey, Dr.
afternoon.
Samantha. Good
Hey,
evening.
hi. Oh yeah, good evening. See you back from work.
Yeah, just back from work, not sanitized yet.
Get it, totally get it. So we'll not take much time of yours. So I would like to introduce you to all of our friends here. So here we have Dr. Chiran, who is a consultant psychiatrist at Kim's Hospital. So we are going to drag you a lot today with different questions. Hope you're ready to take on.
Yeah.
Yes. So how has it been since pandemic, since this lockdown time? I think you're seeing a lot of cases, especially preteens and teens who are more prone to anxiety, depression. So what do you think? How the cases are being handled?
Mm, I mean, it's no surprise that, a lot of people are coming with anxiety and depression. In fact, I'm also tired of listening to the word anxiety and depression because every second patient or almost every patient that walks into the room in OPD is suffering with anxiety and depression. And it's only getting worse with time. And it's not sparing any age group. I'm getting preteens, like you mentioned, coming with anxiety and depression.
Yes.
They telling that, I'm feeling very low, I'm not able to concentrate on online classes. Some of them are coming with even severe symptoms like suicidal intent, etc. Some of them have no stressor as such. They're comfortable in their house, but still they're having these symptoms. But some of them do have multiple stresses at different levels. So yeah,
Okay.
definitely.
Of course, pandemic and lockdown has been a major stressor, but what do you think these preteens, what are the other kind of stresses that you see if it was otherwise pandemic?
I think they're not getting to socialize. I think that's
Okay.
the age where people like to socialize. People like to go to school, have a routine, have some playtime, meet a lot of people, maybe go out to have some community experiences in terms of sports
Yes.
or parties or whatever. I think we are shutting them from all of that and asking them to sit at home for almost 2 years. That's a lot,
It's
right?
it's a long time now.
Yeah,
Yes.
yeah.
And now there is a lot of debate going on as to whether open the schools to junior schools or senior schools. There are a lot of there's a lot of apprehension among we as doctors and also as parents. So what is your take on it? So what do you think about these online schools, offline schools? Do you think this going back to campuses will actually enhance their all-round development?
Um, on a light note, I think kids going to school will help me sleep better because my neighbor kids are always screaming and yelling. They keep me up early in the morning, so I think they should go.
Okay.
But
Okay.
on a serious note, I think we can resume our activities with mask and social distancing. But people are not ready to do that. People are going all out
Yes.
without any mask or social distancing, or they're staying indoors without going anywhere by being very panicky. So I think with the right
Yes.
balance, if you're able to take care of yourself, sanitize and all of that, I think you're okay. But kids
Okay.
again, we can't teach them. We can't expect them to be proper and careful, and they don't know the route of contamination. So maybe it's a little tricky.
Yes, that's going to be a challenge before the vaccination actually comes in. I think it's a challenge for all the junior school students, especially
Yeah.
when the lot of cases that we are seeing lately, right? Many dengue cases and many other viral fevers. Amidst all these different scenarios, I don't know how far we can take them, keeping them off campuses and on online. Yeah,
Mm.
lot of stress, lot of stress.
Yeah.
Now, coming to our topic. So, what does it strike you when we say about nutritional psychiatry? So, do you want to explain this term and how did it come out? Is it very much talked about nowadays?
See, we all know that, diet affects our physical health. I'm
Yes,
sure you as a physician, like the
yes,
dietary advice is included in your consultation. You do tell them at
yes,
least the basics, right? Depending on the time that you have to cut down
yes,
on some things. If you're a diabetic, some kind of food. If you're a hypertensive, some kind of
yes,
food, right? Um,
yes,
Now, in the recent past, there's a big research that came majorly in terms of nutritional psychiatry, where we are understanding how diet not just affects physical health but also mental health, right?
yes, yes,
Uh, so it as simple as that, when you're having a low day or when you're having low mood, how having a block of a dark chocolate lifts your spirits up, right? It's as
yes,
simple as how
yes,
quick it can produce a little bit of serotonin in your brain, a little bit of endorphins in your brain. I mean, it's always been there, but I think now people are getting into, as the each branch is dividing into multiple subspecialties. We are
yes,
finding nutrition psychiatry as a great benefit. India, not so much maybe, but abroad, it's already a big thing. I was actually going to
yes,
some of the videos before our talk to in my car. Um, Nutritional psychiatry is a branch in itself. Like people
yes,
do pursue it,
yes,
right?
actually,
So it was a
yes.
little surprising that I didn't know that. I knew there are like 12 subspecialties in psychiatry. I didn't know nutrition psychiatry is one among. Yeah.
That's booming now. So, what do you think how this mental health is related to diet? Do you want to explain what is the physiology around it? How is it going to impact?
See, for everybody, I mean, you know it. So I'm going to keep it very in a local terminology, right?
Yes,
We know any pregnant woman who goes to a gynecologist, or obstetrician, in their antenatal visits, they are always given iron and folic acid. Everybody knows
yes,
this. Some
very
people
true.
don't even go to a doctor; they take the folic acid by themselves. You know,
Yes,
why is it given? Because in medical language we say neural tube defects shouldn't be there, but at the end of the day, it is for the baby's brain development,
yes,
right? So
exactly. Very
maternal
true.
nutrition itself is super important on how baby is going to perform for the rest of the baby's life,
Yes,
right? Imagine in the environment while you are in the uterus of your mother, if nutrition is so important for your brain development, once you are out and you're on your own, nutrition plays even a bigger role. Every patient walks into my room, I tell them, imagine your body is a vehicle. It could be your BMW, a Porsche, or whatever car you like. That's your body. And it needs fuel. You need either petrol or diesel or, electricity or whatever you need, right? Exactly like that. Even brain needs water, glucose, oxygen. These three are must. It needs these three, otherwise brain can't run. Just like how if you
yes,
don't drink enough water, how we can't focus on what we are uh, supposed to be focusing on. Just like that, these three are important fuels. And how body runs on hormones, brain also runs on neurotransmitters. We call them neurochemicals in local language. So body is run by hormones like thyroid, various hormones, estrogen, progesterone, testosterone, thyroxine, blah, 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 all of that. Just like the brain is also run by neurochemicals. So these neurochemicals production also is dependent on the nutrition that we consume. So diet plays, in fact, I think one of the primitive and most basic role in your functioning. Right now, if I'm able to talk to you, collect my thoughts and explain things maybe clearly, that's based on how my nutrition has been since morning.
yes. That is very true. See, not just mental health, the overall health is as such linked to your nutrition on the diet you take, but that is maintaining your optimum health. But what about people, those who have already landed with these disorders like anxiety, depression, or ADHD, or even schizophrenia? How are these people going to, respond when they're taking these brain boosting foods or taking these nutritional supplements, especially which are very high in omega-3 fatty acids or magnesium? How does these nutritional supplements and nutrition especially target these disorders, these mental health disorders, and to what extent?
I think all these are lifestyle diseases, maybe not schizophrenia, but other conditions that you
Yeah,
mentioned, lifestyle conditions, right? They're not,
yeah, yeah,
they're not infections, they're
exactly.
not cancers. So when you say lifestyle is not just about, your status. If people think lifestyle is status, what car you live in or what kind of house you live in. Lifestyle is about hydration, nutrition, and exercise. These three will
Yes,
decide your life, I think, for the rest of the life. Just when you have a mental health condition, if you start eating healthy, that's not enough. I think we should be eating healthy in general, so we can prevent having a lifestyle disorder.
disorder. Yeah.
Health, physical health, just like that. Let's just say your parents are hypertensive or the diabetics, good chance that you'll also have diabetes. But how can you change it? How can you alter the genes a little bit? Is by changing the environmental triggers. For example, reducing stress, eating right, exercising every day will make you not, it will push your diabetes to like maybe 20 years later. Instead of getting it at 40, you might get it at 60. You might not get it at
Yes.
all. You never know. So just like that in mental health conditions, you can actually prevent to an extent. I'm not saying completely, but to an extent. So just eating healthy is not enough. Eating healthy, exercise, and stress management. If you're able to do all these three, I think you can definitely prevent a lot of mental health conditions for sure.
Yes, because yeah, I've been talking about hydration a lot for, brain, for optimal functioning of the brain. There's a recent study that I have been going through in this Journal of Sports and Nutritional Medicine. So it mentions that a 2% drop in your hydration status or in your body water content, it causes major changes in the way you concentrate, in the way you comprehend things, and the way you, memorize things. So there's a significant, change. There's a study which is done on equal number of patients who have been dehydrated and patients who are well hydrated. They could notice there's a major change, especially in memorizing things and also comprehending. So this 2% drop is a major thing for all of us. So we often forget when we are at work or we are important or we are on everyday routine, we don't concentrate so much on having hydrated or carrying your juice bottles of water with you. But this is a major difference. As simple as this small thing we miss sometimes, right? When we are out for work on major weekdays, we forgot these small things. I think these are the small little things that we need to keep in mind, right? And yeah, because you're
You know,
talking about gut health again. Nowadays,
no,
there's a lot of research on
one,
gut. Yeah, yeah.
one
I,
second, sir. So
I
about
won't wait.
hydration, I think it's not about forgetting. A lot of people, even if they don't have any work and sitting at home relaxing entire day, they do not just get up and drink water. I think it's a
Yes.
habit that we need to develop in our children, because like I was made to drink a lot of water as a child, because I have daughters in the family and they know the importance. So they're like, go get your water, go get your sipper and finish it, in another 1 hour. And a lot of us don't do it. Most of our parents are very keen on having a healthy baby, giving a lot of food, but they don't really care about water. Most of my patients, when I
Yeah.
ask how many glasses of water you drink per day, they say, I whenever I eat, doctor. Well, how many times you eat? 2 to 3 times.
It's
So they
just three
drink two to
times.
three glasses of water unless it's summer.
Yes. Yes.
Yeah. I think it's not just forgetting, it's a lifestyle change that we all need to collectively do it, right?
Yes.
Yeah.
Yes, laziness plays a major role in all these little things, wherein we need to get moving, but we can't get up. That is the thing.
Yeah.
See, there's a quote which I read from another book. See, if there's a small micro work that you need to finish off in 1 or 2 minutes, you should not delay or postpone it. You cannot procrastinate for it. You need to get up, finish it off because it's just a work for 1 or 2 minutes. So
Yeah.
if we can come up with agendas like this, then maybe we can consider.
Yeah.
So, while we are talking about this, I would like to take this question for you. We have it in the comment section below. Karu, caffeine and sugar is dehydrating further. So, do you want to comment about caffeine here?
Okay. So I was going through some of the research, and some of the research actually says a little bit of caffeine is good for your mood in terms of it increases your alertness and concentration and focus, guided
Yes,
focus. But too much of it can worsen your anxiety by dehydrating you.
yes,
Uh,
yes,
so again, how much is too much? How less is too less? We don't know. It depends on independent like bodies. Maybe
yes,
a glass or half a glass, not like black coffee with like entire caffeine gushed into it. I think maybe a little bit of caffeine is okay, I guess. But yeah,
Yes.
but people who say that, I'm caffeine addict, it's become such a fashionable term, like how going to Starbucks. And I know many people
Yeah.
who don't like coffee, but they are always in Starbucks. I think it's become such a lifestyle thing where you go to
Yes.
Starbucks and get your name on the coffee. But I think it's better to avoid it. On the days where you're feeling very like foggy and you want to lift the fog of your brain, maybe a little bit of coffee is not a bad idea. But it'll keep you up if you drink after 6 p.m. So you should make sure that you don't want to be excited before you go to bed. You want to be mellowed and calm down. So
More,
rather have
yes.
normal tea. Yeah.
Very well said, Dr. Sharon. Having caffeine in moderate amounts, that is what they need to figure out. And what is moderation is very individualized. We can't comment on these many ounces because people who take caffeine regularly, they are used to 32 ounces, the very big grande glasses at Starbucks. So I think they need to moderate. And also in South India, we have this fashion of South filter coffee with milk and loads of sugar that is
Obviously.
going to be very, very bad on your cortisol levels. It is going to,
Yeah.
fire us up, which is not a very good idea. Maybe black coffee is good, but again, in moderation.
Moderation.
Yes, very, very well said. And yes, coming to the next question that we have from most of the people. Now we see a lot of people doing this, podcasts and coming out with, we have influential people who are doing videos on brain boosting foods. Can you name these brain boosting foods, few of them for our listeners?
So, brain boosting foods are essential foods that are required for optimum functioning of your brain. For example, I'm supposed to focus. Let's say this talk is for half an hour. That's what your brain can focus. It can't focus for 1 hour. That's normal focus. For that to be even maintained, your brain depends on fuel. That's like I already said, like water and all of that aside. It also needs some micronutrition, nutrients and vitamins in them. So one of the first things you should think about is seafood. Seafood is one of great source of brain boosters, but a lot of us don't eat seafood. I think we in India at least we eat meat a lot because it's easily available and also maybe not so expensive as seafood. I think a lot of the categories eat that. I think seafood is
Yes.
definitely a great idea. Along with that, turmeric. Turmeric is very, very healthy. That's one thing that Indians do it right. All our parents,
Yes.
especially in South India, we put turmeric into everything
Yes.
to give the color to whatever dal you make or whatever. So turmeric is good because it even helps in clearing of. There's something called amyloid plaques in Alzheimer's dementia, right? It even
Yes.
clears
Yes.
there's something called curcumin in turmeric that actually helps a lot. Dry fruits are a great idea, but dry fruits is not you eating one a big jar of dry fruits. Like maybe like two or three each every morning is also one of the brain boosters. In fact, caffeine is also under brain boosters, right? But
Yes.
again,
Yes.
I always never tell caffeine, I eliminate caffeine because people end up drinking too much, saying that Dr. Charan said so. So that we
Okay.
can avoid. And a lot of seeds are coming into big role for brain boosting food. So again, not a lot of seeds, small quantity, maybe like half a spoon of pumpkin seeds or watermelon seeds or sunflower seeds, etc. There are, if you go to like a Qmart or Ratndik, wherever you get these seeds. So eat little bit, everything. See, even good food, too much of it is not good. It has to be moderated. I think moderation is
Yes.
the key. That's one thing.
Yes.
Um,
Yes.
Obviously, eliminate sugars and all of that. I think brain boosters is mostly this. If I'm not missing anything, if you can add something.
Nothing except for berries, but Indian, what is available with us is more important. So we can go with mulberries rather than, getting into big supermarkets for blueberries or blackberries. And coconut, yes, coconut is also one of the wonderful
Yeah,
fruit and water that we have with us. We should, not just in summers, otherwise also, it's very good to have fresh coconut and coconut water.
yeah.
Yeah,
There's a
these are the
joke
two
about
things that
Kerala that Kerala's literacy rate is linked to the coconut oil that they use to cook.
that they eat, drink, and put on everything. So they are one of the smartest people on earth. Yes.
Yeah.
Yeah. So have you seen how far in your clinical practice, Dr. Charan, that you've seen numerous depression cases? Out of these, how many are mostly linked to nutrition deficiencies? If so, what is the vital nutrient in most of your cases that you've seen that they're deficient of?
See, I work in Kondapur area. It's mostly IT crowd is what I work with. I'm sorry to say if any IT employees are looking at this live. I think horrible dietary habits IT people have because they have sedentary lifestyle. Just like us, even we doctors have sedentary lifestyle. We sit and work. But fortunate that
Yes,
we don't work with screens. We work with real people. So some less eye strain.
yes,
A lot of them, especially in pandemic, they're not getting sunlight. If there is no sunlight, there is no vitamin D. Vitamin D deficiency, every second patient has it. In fact, I will tell you guys how important vitamin D is. I think somewhere in the month of March, I think I was feeling very low. I was not able to concentrate. When patients are telling me I was easily getting distracted. If someone comes close to door, I would like shift my focus. Again, it takes some time for me to get back to what patient is telling me. When I come home, also I was not able to sleep well. I was feeling very lethargic. I gained weight. So I had depression in my teenage. So I thought maybe it's recurrent. It's come back. I was very scared that oh my god, do I again have to get treated? It's not fun to get treated, right? I was
yes.
thinking, and then I thought, okay, let me check my vitamin D levels. I checked, and they're severely deficient. They were seven. Seven is
Oh my
under
God.
deficiency, not insufficiency. I
No,
started
it's
taking
severe
vitamin D.
deficiency.
Yeah, I started taking vitamin D, and in a month, I'm so much better, almost like back to normal. So vitamin D is extremely important. I explain this because of that, but that doesn't mean you all can go now to pharmacy and start taking vitamin D without assessment and doctor's advice, because there is something called as hypervitaminosis also. People think too less of vitamins is only a bad thing, but too much of vitamins also is bad thing because it can cause toxicities. Again, we have to give you
Yes,
antidotes and bring it down. It's another headache. So do not keep taking it. Best way is for you to wake up in the morning, get exposed to morning sunlight for an hour or 45 minutes, maybe do yoga, some stretches in the same time. So it's just one bird and one shot and two birds. You're able to get your vitamin D and also finish your exercise in the morning. So it'll increase your vitamin D and exercise increases endorphins. Both works perfectly in increasing your serotonin. So you're able to have a stable mood mostly for the rest of the day. So vitamin D is one thing that is vital. B12, vegan food has become very popular these days. A lot of people that I know are also eliminating dairy and eliminating,
me too.
yeah, all of that, right? So, and vegetarians, obviously, they don't eat meat. In these people, you see a lot of vitamin B12 deficiency, especially. That also is linked to causing withdrawal, depression, and a little bit of anxiety as well. People who eat eggs, they get good amount of vitamins vitamin B12. So at least eggs, I force my vegetarian patients to have egg once a week, unless you throw up. That's a different thing. But otherwise, please have. So D and B12 is what I could think of.
Yes.
Yeah.
And what do you want to comment on essential fatty acids, Dr. Charan? Because lately, essential fatty acid deficiency or insufficiency or reversal in omega-3 to 6 ratios have been a trend now. Most of them are very high in omega-6 but very low in omega-3. One of the reasons, maybe as you mentioned, we are not living near the coast that we eat seafood every day and it's not affordable for most of us, or we cannot reach them. So whatever is reachable is convenient or sustainable is what we consume. But in that scenario, we lose most of the essential fatty acids, I believe. What do you want to comment on that?
So omega-3 fatty acids, when I was studying my MD, I used to see it like at multiple diseases. That's when even now, that's the first thing I could think of that, oh my God, like something as essential as omega-3 fatty acids. They're seen in many conditions. It's seen in schizophrenia, depression, bipolar, other mood disorders, anxiety, Alzheimer's. All these conditions, we see, not just Alzheimer's, dementia in general,
Yes.
we see that omega-3 fatty acid deficiency is by largely one of the causative factors. So I think having food, like I said, seafood and other omega-3 fatty acid rich foods are very, very important. If you're at least not able to eat that, maybe supplements is not a bad idea. But at the end of the day, natural diet is the best way because the absorption and bioavailability of a natural protein, amino acids, and carbs is the best for your body rather than the store-bought vitamins or
Yes.
people who come from USA from your Target. That's not going to help too much.
Because you're commenting about carbohydrates, now I want to mention something. Many of them go on restriction diets or no carb diets to very low carb diets. So, do you want to comment on carbohydrates and how important it is for not just brain health and overall health?
See, the basic energy source of your body is carbohydrates. You can't eliminate it. I did it. I did keto diet for like almost 1 month. That was the worst month of my life. I thought like I would die of a road traffic accident because I just can't focus. On Indian roads, if you're not able to focus with people coming all over your car, it's very difficult. I would wake up feeling groggy. I think that's 1 month where three of my secretaries changed because I was very cranky at them. I'm just being very honest.
Okay.
So it maintains your mood, it maintains your cognition, it maintains your general activity, physical or mental activity. It makes you very sluggish if you eliminate carbohydrates. The key here is for you to eat complex carbohydrates that take some time to
Yes. Yes.
slowly get digested and absorbed, and also doesn't cause such sugar insulin spike at large. That has to
Yes.
be, I think,
This
yeah, whole
very
grain
well
is a good.
said. Yes, whole grains. Since when we talk about carbohydrates, everybody will get into this idea of taking flour or taking flour mixed with sugars or refined carbs. They should understand that carbs are important only when they're more complex, the better, because the
Yeah,
less insulin we use up in the body.
yeah.
So here we have one question from the followers about fasting as therapy for depression. Have you heard any of this?
See, intermittent fasting, when you say fasting, I think intermittent fasting is what they're saying. Intermittent fasting has a lot of health
Yes.
benefits, is what they say. Um, I genuinely believe in traditional way of eating multiple small meals. I mean, as a physician, I'm assuming you advise the same way, multiple small
Yes.
meals all throughout the day is the best way. So because I'm not a nutritionist, I don't know too much about what is the use of paleo diet or intermittent fasting or keto diet. I don't know all of this. So I think best is to eat in moderation multiple times. So I think that's.
Okay. So, can genetic mental health issues, do you think, how often do you see them genetically if parents are having? What percentage do you expect in the children? If at all they're positive or, genetically they're more prone to have also, if the people who are worried, if the parents or their relatives at home have this, should they be worried or how should they tackle it?
See, most of the mental health conditions, they're not absolutely genetic. When I say that, you do have genetic susceptibility of developing a disease, but also environment plays a huge role in converting that genetic vulnerability into an actual
Yeah.
disease, right?
Yes.
Uh,
Yes.
so if you are able to, even if you have genetic parents with a mental health condition, if you are able to make sure your lifestyle is good or your environment that you are putting yourself is good, be it in your mother's uterus that you have no control over, or the school that you go to, or the workplace that you work, or the profession that you choose, people you hang out with, what kind of habits you have, all these together play a role in manifesting a disease. So it's not just entirely genetic. So yeah.
Yes. Since you were talking about genes, so we need to switch on the genes. It's just presence of genes is not enough. We need to switch on and off. We can always switch off the genes by a right, lifestyle and removing stress. And we should know how to handle stress rather than saying not to have stress. So we need to have better ways to handle them. Yes, that is all very important. So, and nowadays we hear a lot of inflammation, right? So, what is the role of inflammation in mental health? And do you think our right lifestyle and right way of approach to nutrition will help us get out of this inflammation?
Oh yeah, for sure. Actually, more than inflammation, I think chronic inflammation is what is
Yes.
linked to your brain health in generally, because it fastens the degeneration of your brain. And not just psychiatry, you also get a lot of neurological diseases because of inflammation. And most of the foods that we eat are, sorry, 1 second. Yeah, most of the foods that we eat are. Hello.
Yes, you're back. Yes, yes, you're
Yeah,
back.
my call start. uh, well, yeah.
It will
So
not
most of
take
the
much time of yours now.
Yeah, yeah. So most of the foods that we eat are pro-inflammatory. Instead, we should be eating anti-inflammatory foods. Again, anti-inflammatory foods, they go back to more or less the same things that we spoke about. Um, See, a lot of people think inflammation is swelling. It's not swelling. For people who think inflammation means swelling, it's not swelling. It's your body's defense mechanism But if you're eating foods that cause inflammatory mediators from your adipose tissue or your body in general, that is not good for your health. So I think we should choose foods that are anti-inflammatory. What are they? I think you can just Google.
I
There's
think
something called, yeah.
yes.
I always tell my patients, Google is one thing that works well for nutrition. Like, you can do it. Don't Google
Eh, eh,
diseases, symptoms, diagnosis, all of that, but you can
no
Google.
self-diagnosis, no self-medication, no
Yeah,
self-treatment, no
yeah,
Google
yeah.
treatment for the
Yes.
yes.
But
Um,
Mediterranean diet works well, is what I heard, because it's
yes,
anti-inflammatory. It cut down your caffeine and sugars, etc. People think eating sugar makes you happy, but again, sugars increase inflammatory, cytokines, etc. That actually worsens your mood on a long run. Even though it's a quick fix for your, happiness,
mood
but on a
swings,
long
yeah.
term, it will cause depression. So we need to understand that.
Yes. So also we need to cover about hormones because we are talking a lot about depression. We see most of the women with anxiety and depression disorders, and PMS and their hormonal disturbances are one of the major drivers. As in my practice, I see many of the women are low in progesterone or high in estrogen, and they'll end up with depression. For these kind of people, we need to treat the root cause, I feel. So it's very important for people who are having these depression-like symptoms. They should also think about their nutrition. They should also think about their, lifestyle, their stress, and the fourth thing is their hormones. Very,
Yeah.
very, very important because that is a major thing which plays a role once they finish their 30 years and they get into busier life schedule and then miss out on balancing these hormones. But I think they play a huge role. And what is your experience with these kind of patients, Dr. Charan?
See, especially in women where there is constant flux of hormones, more than men. I think men do have more or less stable hormones, right? Till they turn like
Yes.
maybe 50 or 60, it's different. For women, it changes every like 25 days or 28 days, depends on the length of your cycle. I think, especially if you're having something like premenstrual syndrome or PMS, even if you don't have PMS, but during your cycles, and it's always good to probably, I think, reduce your salt intake because, the bloating. Salt and water are friends, basically. If you eat more salt, all the water that you drink gets retained in your body. It worsens your bloating. So that's one thing you can reduce. Again, eating a lot of green leafy vegetables, high fiber, is very, very helpful to reduce lethargy and fatigue throughout the day. And again, vitamin D plays a huge role. B12 plays a huge role. Um, I think B complex in general also plays a huge role here. C plays a huge role. Oranges, citrus fruits, they also help in your PMS symptoms also. More than, I think, all of this, I think calcium is also very, very important, not just premenstrual, but also postmenopausal symptoms. People who have a lot of hot flashes, mood swings, etc. Calcium helps a lot. So people who are eliminating dairy, thinking they're lactose intolerant, because most of the people are not lactose intolerant, and you know that. I think it's
Yes.
maybe not a great idea. Yeah.
It's not about lactose intolerance, but dairy as such, when they're chronically inflamed or when they have this GERD symptoms or acid reflux, milk will increase these symptoms. That is
Yeah.
the only reason why some of the GPs or nutritionists may ask them to avoid milk for certain time, but doesn't mean they have to avoid it for their, lifetime.
No, but these people I'm talking about are self-diagnosed lactose intolerant.
Okay.
Those, no.
Okay.
So I have a small question for you. So what calcium-rich foods can we suggest for those patients who maybe shouldn't be taking like milk or curd or anything?
So if they're not taking that, vegetables are a very good source. Out of them, mushrooms they should be consuming. And also nuts. They think nuts are just for omega-3 fats, but yes, they should consume nuts as well. And for vegetarians especially, what they can consume is only five groups of foods: nuts, seeds, green leafy veggies, fruits, and carbs. These are the only five group of foods they have, eliminating this egg and dairy products. And coming to this question from Shovi Wovi. Okay, I would like to name some anti-inflammatory foods since he mentioned here. So apart from these five foods that I mentioned, leafy greens, vegetables, fruits, nuts, and seeds, we can have green teas, we can have olive oil. But remember, olive oil is not very good for Indian cooking. Please don't heat the oil and spoil it. You can just use it on your salads, but you cannot boil it up. or you cannot cook it with Indian kind of cooking. So yes, olive oil and coconut oil, as I said, is good for cooking, but it gives that a kind of flavor where many people cannot adapt. If not that, you can at least go with cold pressed oils, which are less in omega-6 fatty acids and more in omega-3 fatty acids. And for non-vegetarians, you can go with fatty fish, not just casual any other fish, but fatty fish. And yes, all home. Condiments, Indian condiments are very, very good. That is the reason during pandemic time, many have come up with all these anti-inflammatory, immune boosting foods, immune boosting drinks, especially the turmeric, the ginger, the basil or tulsi as we call. So all these are anti-inflammatory.
Yeah.
Yeah. So yes, I want to ask you about very important thing nowadays. Since pandemic, I think Netflix has been running non-stop. So this Netflix and binge eating has become a trend nowadays, right? So is it likely that this sort of approach or just this binge eating and watching a lot of screen is going to create any mental health issues in the long run? And how do you think we should approach it?
Sorry. Yeah.
Yeah. Yeah.
Am I back?
Yes, yeah, we
Yeah.
can
So you
clearly
said
hear
Netflix
you.
and binge eating. Yeah.
Yes. And have you been
I
noticing
missed the
any
last part
mental
of the
health?
question.
I'll ask the question. So, do you want to comment on any mental health disorder which is connected to this binge eating and seeing a lot of screen or increasing the screen time?
See, obesity by large is one of the important risk factors for a lot of mental health conditions, especially
Yes.
bipolar, schizophrenia, and depression. These three are directly associated with your metabolic diseases and obesity. Even if when you look at metabolic syndrome as such, that that physicians talk about, most of them do come with depression, anxiety on later date. It's part and parcel of it. So clearly, sitting in home, not having physical activity, etc., is playing a huge role in depression and anxiety. People who get moving, uh, are definitely at less risk. It's not just this. I think screen addiction itself is a disease. Forget about what disease
Yes.
it leads to. Screen addiction itself can, because it makes your mental reflexes very, very sluggish. If somebody is like feeding you creativity, somebody is feeding you thoughts, you won't be able to process your own thoughts and emotions. It's like you're a robot where people are telling you cry now, laugh now, process it now. I think rather than
Yes.
watching screens, I think painting is a great idea. Maybe cooking a healthy meal or bake, that's a good idea. Instead
Or
of
even
playing
reading a
Ludo,
book.
yeah, reading a book. Instead of playing Ludo on your phones, why don't you actually play Ludo? I think I think find replacement of screen activities into non-screen activities. See, can I do this without screen? If you can, go ahead with it. Even if you want to log something, even if you want to write down something, you don't have to type it on your screen. Write down on a piece of paper. So eye strain will be reduced, your brain strain will be reduced. You'll do a lot of good for your own body.
Yes, these days lately I'm having my own book where I write my routine stuff. I put down my schedule in it. So I stop, even I'm trying to eliminate most of my screen time by bringing these little changes, like writing your own schedule or planning your own day or write your more priority list. So I think that way, at least we can give some activity to hand muscles as well and improve our
Yeah.
hand and brain coordination a bit,
Oh, yeah.
you know, because nowadays we are fast at typing than at writing.
Yeah.
So it's not a very good idea. It's good to, type fast, but we should not forget to, write smoothly as well.
My
So,
hospital asked me to give prescriptions on a computer, printed. When I said no, I'll write and give. That's better. I'm able to, because
yes,
I'm able to naturally process things when they're talking to me. I can write better than figuring out where is the T on a
I
keyboard.
know, I know, I
Yeah.
know. So yeah, great stuff, Dr. Charan. I think we have discussed a lot about, food, health in general, mental health, and yes, a very good info that we have got today.
Yeah. One small
So
thing I want to
yeah,
add before I go is definitely in Alzheimer's dementia. See, dementia occurs because of decrease of a neurotransmitter called acetylcholine. To
Yes.
form acetylcholine, you need something called as acetate and choline. So for choline, it is available mostly in eggs. So I think
Yes.
eating an egg very frequently, I think is a good idea, especially for people who probably have a family history of Alzheimer's dementia or any other dementia. Like I already said, I think turmeric is very good because the curcumin present in it helps clear the amyloid plaques. That's another thing. Eating dry fruits, a bit of seeds every day, eating easily digestible foods, all these are helpful. A lot of fiber is also very important. I think unprocessed oats is a great idea. Millets, I think people can have digestive issues. Can so maybe I think
Yes.
oats are easily far more easily digestible is what I think. Correct me if I'm wrong, Dr. Samantha. Please feel free.
N-
Uh,
No, this oats, as you said, is very good. But yes, with millets, there are certain people who have these gastric issues, but there's few small percentage of people who are okay with having millets. So it is again individualized, more individualized. Yes.
yeah, yeah,
Yes. Great stuff. I think it's sort of different talking to a psychiatrist more about food today, more on
yeah,
the preventive aspect, preventive side. It's very nice to hear. I think we should take on with session two
yeah,
about treating aspect. I think we'll
yeah,
get back to that later.
yeah,
But
for
I
sure.
think we got good information from you today. Thank you, Dr.
I'm
Charan.
glad. Thank you. Thank you for choosing an offbeat topic because, like I told you before, I was getting bored with the same topic of stress management in pandemic. I'm glad that we did something new today. Thanks a
Okay, that's nice. Nice. Thank you.
lot.
So good day.
Take care.
We don't want to keep you waiting. I think your
Yeah,
patients are waiting too.
yeah.
Bye-bye.
Bye. Take
Bye.
care. Good
Bye.
day.
You too. Bye. You too.